Hi, everyone. Welcome to the first part of a four-part set of lectures on health and climate change. I hope you get a lot out of it. We're going to be covering a little bit of everything. Please talk about this because Matthew Nesbitt, he did a lot of research into what motivates people to support climate action. And what he found was that when climate change is connected to health and connected to health risks, people became more motivated to participate in and support climate action. So please do talk about it. Health is in the home. If we can bring climate change's impacts on human health into people's awareness, then you're bringing it home for them. The presentation across all four, this is about all four little 15-minute parts. Altogether, they're going to go over climate change's impacts on human health, specifically who is more impacted, and four climate change health patterns that I've observed as I've learned about this topic and taught this topic. One health concern that is associated with all four of those patterns. And then as we go, I'm going to include solutions, what other people are doing, what you can do, and what still needs to be done, just so you're not having to wait till the end to hear the happy, good news. I'm interspersing that in with the bad news, hoping that helps. Everyone's health is impacted, especially if we have one of these health conditions: a respiratory condition, diabetes, cardiovascular condition, a mental illness. Anybody here have an allergy to pollen? Disabilities also put us at higher risk, and if we work or play outdoors. So what I'm saying is no one is going to escape climate change's health impacts unscathed. Everybody's going to feel, for example, a heat wave. But the people with these health conditions are going to be at higher risk. Here's an image that you already saw in a previous lecture, so here it is again, so that we can now look at what solutions can be done. Some of the solutions could be adaptation plans to consider communities of color first and foremost when it comes to access to healthcare and help address the social inequities that they experience. And let's stop dumping pollution in their communities, which is a history the USA has. And you can see the rest for yourselves. I don't need to read them all out to you. You can pause this presentation to take a closer look. Still to do is that we need to learn here in the United States how to put the most exposed to climate change health risks at the top of the adaptation to-do list. We're not very good at prioritizing vulnerable populations. We do a great job talking about vulnerable populations and that they are at risk. We're not very good at translating that talk into action. And so in this presentation, I'm going to include what a city in India has done and how they implemented a program to help their vulnerable population survive heat waves and what they did. A few specific things that we have to improve here in the United States include, and it's not limited to, this is just an overview, but the first two biggies that pop to mind are these. Our water infrastructure is breaking, it's getting old, and I'm talking about water treatment and water delivery pipes, etc., and water treatment plants. Their infrastructure is getting older, it's not up to date. We need to fix that for water quality needs moving forward. And our healthcare system, you may have heard, is the most expensive in the world. That's true. We don't have health insurance for every American citizen, and we don't have enough healthcare workers for all the patients who need healthcare. So we need to start getting to work on boosting our healthcare workforce supply, lowering the price of healthcare for Americans, and making it so we can either afford to buy private health insurance, let's lower those costs, or figure out a way to create universal health insurance in some way that is, what most of us can buy into. Bottom line, we have to figure out how to make it so that all Americans have access to health care moving forward. Another concern to look at is where we live. Here's an image of an urban heat island. And what I mean by urban heat islands and what other people mean by urban heat islands is that they are hotter than a rural area. Temperatures are 5 to 18 degrees Fahrenheit higher in urban areas because of dark surfaces like traditional roofs and roads absorbing the sun's heat and radiating that out. And they're 5 to 18 degrees hotter than surrounding areas. Here's a solution that the city of Louisville, Kentucky is doing. They found that the city of Louisville runs about 10 degrees hotter than surrounding areas, and they have started a program where they're encouraging buildings to have green roofs, which you see pictured there, and or white roofs. And what these do in terms of heat and surviving the heat is green roofs and white roofs make it so that the building inside isn't as hot as it would be with regard to hot sunny days. The benefit of a green roof, though, it has an added benefit, and that is maybe you've heard of acid rain. That goes back to when we had a lot of sulfur going into our atmosphere, and it was mixing with H2O to create sulfuric acid, and that was coming down and ruining our wheat crops. Though we started to control how much sulfur goes into our atmosphere, but what I'm trying to say with that example is we still have pollutants raining down on us. We're still polluting the atmosphere, and the rain is still making that pour down on us. And what a green roof can do is filter that rainwater. So when it trickles down to the street and goes down a drain and ends up in a water treatment plant, that water treatment plant has less to filter out of that water. So that's an environmental benefit of a green roof. Some people think that a green roof is going to filter air pollution out of the atmosphere, and that's not true. It will take carbon dioxide out of the atmosphere, but it's not going to take out lead or another pollutant that might be in the atmosphere. It's just whatever a plant naturally takes out of the atmosphere, which includes carbon dioxide. The white roof, that has less benefit environmentally speaking, but it does, like the green roof, help insulate a building from the heat. So what both these roofs do is they also cut down on how much air conditioning a building has to use, and that when you do that, you're cutting down on carbon emissions, right? If you're not using air conditioning, you're not using energy, so you're not burning as much fossil fuel. Another thing to remember too about air conditioning is that air conditioning in of itself releases its own kinds of greenhouse gases. So the less air conditioning we need, the better. And a big blessing there is that even though these don't cool down the city of Louisville, they are helping people cope with the heat. These two ways. In Toronto, here's a hospital that is doing the exact same thing. This is their green roof. And in the United States, there are around 60 hospitals that are doing leadership in energy and environmental design strategies. And for this particular hospital, that cut this hospital's energy consumption by 40%. Hospitals are one of our big greenhouse gas producers based on how much energy they consume. So there's another and more direct to climate change mitigation and adaptation advantage to a green roof. You cut down how much energy a hospital is using, you're going to be pumping less carbon dioxide into the atmosphere. Closer to home, here's a really exciting community neighborhood action that is happening in Tucson. It's in Tucson's Dunbar Spring neighborhood. It was spearheaded by Brad Lancaster. And if you have not heard of Brad Lancaster, I very much hope you look him up on Google. Just Google Brad Lancaster and rainwater. He is a dynamo. A lot of passion and energy with regard to the idea of use the rainwater that is coming down and make neighborhoods green. So here you see a photograph of in 1995. This is what the Dunbar Spring neighborhood looked like. And in 2019, you see what that exact same intersection looks like. And I hope you see how green it is. It's remarkable. Well, how did he do it? We're always thinking of Tucson, especially being dry and desert, and how on earth do you grow green in Tucson? Well, Brad Lancaster found that Tucson actually gets more rain over the course of a year than the population would consume. So he thought, well, what are we doing here? Why are we wasting all this rain that's just falling from the sky? And he figured out that if you cut the curb, he noticed that the rain, I should backtrack, that the rain was just going down the street into a gutter and taken away. So he broke the law and cut the curb to see if he could get some of that rainwater to come onto a place where something could grow. And eventually, the city of Tucson liked what he was doing and made it legal. It is now legal to cut a hole, cut the curb, and collect rainwater from the street in Tucson. Anyway, there's how it works. When it rains, the rain will be flowing down the street, going into the gutter, and you cut the curb and you dig a hole and you plant whatever you want to plant in that hole. And whenever it rains, the water will flow from the street into the hole and water whatever you're growing there. And one of his favorite things to say is, I don't need no daggone hose. He likes to say that. He and his neighbors are growing mesquite trees, and they do collect the beans and they do grind them into flour and they make pancakes and that sort of thing. So here's an example of how in an urban area you can grow food, which is important to climate change, and the reason why is I'll explain in a little bit. Here is Brad Lancaster, the man himself, and he's pointing to this map. This is a map of his area, and his neighborhood is outlined in yellow there. And what you see is the impact of all the shade that this neighborhood has now, because everybody in the neighborhood is joining in on this method of collecting rainwater to grow plants. If you look inside the yellow line, you'll see a lot more green and a lot more gray compared to areas where there's little green. If it's gray, it's cooler. If it's red, it's hot. So it's pretty cool. And I've walked through this neighborhood and I can tell you it's remarkable. We were in a hotel that was just outside of the neighborhood, and it was as though I had stepped from a nice cool place to walk into an urban heat island. It was so marked. I hope one day, if you haven't visited this neighborhood, that you do. Brad Lancaster is open to visitors if anybody wants to learn more about what they're doing. And now, thank you so much for listening to this first part. I'm going to stop here and we'll continue with part 2.